Welcome to Helping Seniors Radio with your host, Joe Steckler, and his guest, Dr. Lee Sheldon. We'll join the program already in progress as they talk about the realities of cost of health care on AM 1510 WMEL, the Talk to Me network.
Picking up on that, I was talking to a person the other day that they're a single parent and they have one child, and I asked what the cost of their insurance per month was, and they pay $874 a month just for the parent and child. And that's a lot of money for this single parent to be paying. And I asked why they didn't look into the Obamacare, and the person told me that once you've tried that, you don't want to go there again. They told me that the quality of the medicine, the settings, the service, everything that you just described that makes for a good setting in a doctor's office were not existing in this low-cost medical practice type service that we're offering under Obamacare. And you know yourself, and you've said it, all doctor services are not equal. They're not all the same. Not all offices are the same. Not all staffs are the same. The people that come into the office already have a big enough problem. They don't need to have more stuff added on them. So go back to our first basic question.
Okay.
What should your expectations of a doctor be?
I think the expectations, number one, are care and concern from that doctor. Number two is friendliness from that doctor. Number three, time well spent. And I'm not talking about amount of time. I'm not talking quantity of time. I am talking about quality time where the doctor is there talking with you. Not talking about your symptoms, not talking about your pills, talking with you in order to be able to make sure that that doctor is really addressing what your needs are.
Like when I went to a doctor the other day for the gout, and he's looking at my foot, my leg, and everything. He has it up on his lap, and he says, "How long has that been there?" It was a little like a welt. And I said, several weeks. I thought I got bitten by a fire ant. And I wasn't sure. It itched, but it hasn't spread or anything. Nothing else has happened. And I think he was a little concerned about it, and because he didn't know what it was. And he asked me a couple of questions about it and then prescribed something because he wanted to see if that thing will go away. But, you know, I understand what you say, because when I go to my doctors, and they talk about me, the problems that they see in me. My cardiologist, sad to say I've had for 20-some years, is retiring soon. And I really...
Gene's still too young to retire.
He's going to do it. He's going to retire.
He's younger than I am by far.
I know he is. He's 5 years younger than you are. He's going to retire. And I asked him, I said, well, how can I still see you? He said, you can't. And that really bothered me because... Wow. You know, sometimes, Lee, many of us have doctors that we can talk to. I can call you on the phone. I've asked you questions, not just dental questions, but health questions, questions of body, different things that have happened, different types of medicines and what to take. And you've always taken the time to answer. I'm sure you do that because with your own patients, you give them your private cell number so that if they have a question, they can call you and answer. But how many doctors do you think do something like that?
Oh, I don't know. There probably are very few, but that isn't necessarily the entire thing. Yes, I want to be available, but but also understand that I'm in an elective healthcare service.
Right.
So I'm not, if you get a temperature at night, you're not going to call me anyway. If you're sneezing or you have a cough or something like that, you're not going to call me. You're going to call me with the true dental emergency, and hopefully we've done our job well enough, and you have too, that those dental emergencies are going to be very, very few, and they are. That's a little bit different from the physician who's doing primary care medicine and being available. But at the same time, I feel a little bit bad for the GP right now, and I'm talking about physician, because they have to think money first. And as soon as you think money first, then everything else is secondary to money. Well, what do I mean think money first? They have certain structured payments they're getting, whether it's from Social Security, whether it's from Medicare, whether it's from the insurance company, or whatever it is, which kind of dictates how much time they can spend and dictates the amount of money they can spend on office staff, because the insurance company has already determined you're only going to get paid this amount. And so therefore you either have to reduce your time or reduce your expenses in order to be able to do that. And so what's happening as a result? There are a number of physicians who are saying, the heck with this, I'm done with insurance. I'm going to open up my own concierge type of practice. You pay me a certain amount of money per year so that I can practice the way I want to practice medicine, and then we can go back to customer service, or patient service, or doctor-patient relationship, however you want to say it, the way it used to be.
One of our children has done that, and the fee for that is $1,500 a year for the family.
Yes,
cheap. Now, it's very, very inexpensive, but of course, there are other expenses might not be covered in that. But
That's right.
General thing, he's a pilot, and he can call anywhere in the United States and ask his doctor a question,
Yeah.
and it's covered.
Yeah.
So,
But understand, on the other side, we've got the patients who are expecting everything to be covered by insurance. And
It's not.
And it's not. Or if you expect that, then also expect a lower level of service, because frankly, the doctor can't afford to provide the service that you're looking for when that third-party payer is paying in. So in dentistry, it works a little bit different, because for the most part, we're still in a fee for service, or free, I call it fee for outcome, I don't call it fee for service, where you come in, you get, the doctor charges what he or she needs to charge in order to be able to provide both the good service, the best labs, the best everything, and time with the patient.
Yeah, dentistry, you're right. Dentistry is different because you don't have you have a lot of complexities involved, but you don't have the complexities involved like you do in the whole body with the surgeon operating from the neck all the way down to the feet.
No, but it depends on, now surgeons aren't paid very well either. They really aren't. For what they do, they're not paid very well. And so then it becomes more of, there's a little bit more concentration on time production and less time on customer service.
Then
so
tell me something.
We understand that.
As a doctor,
Yeah.
then why can't those 554 or 555 people sitting in Washington, D.C., we name congressmen and senators, why can't they come up with a better health care bill that pays our doctors what they should be paid and drives the medical costs in the hospitals down to what it should cost?
Well, I got a personal feeling about that, which you always hate whenever I say it, but what the heck?
Go say it.
I think the model that we had in the 1950s is a much better model of medical care than we have right now. And I don't think we'll ever get to the model of medical care of the 1950s again.
No, I know.
Because
My brothers, their first baby cost $50.
That's true.
Yeah.
But also you paid the hospital directly, you paid the doctor directly, and therefore you could choose what doctor you wanted based on the level, based on whatever experience you wanted.
Yeah.
And there was a direct relationship between the patient and the doctor. As soon as you put that third party in there, government, insurance, whatever it is, as soon as you put the third party in there, the third party is trying to control it from both ends. And the third party needs to be paid. And so if I'm hiring, let's assume that I'm a doctor and I'm running and I'm working with an insurance company, and you're a patient and you're working with that same insurance company, don't you think the insurance company is going to make a little bit of a profit?
Oh, I know they are.
Okay. So in dentistry, even in indemnity insurance, they're running 25 and 35% profits. Imagine if you had that money yourself and you could pay me directly. All right. Then this 35% isn't there anymore. And therefore, there's a little bit more money to go around. But our expectations are we got to buy health insurance in order to be able to make things work. And the answer is no, you don't. You really have to buy health insurance to take care of catastrophic care. You know, if you have something
Like
that's going to amount to
my
$10,000, yeah, something like that. Something's going to cost $10,000 or more. You know, come up with whatever arbitrary figure you want. And by the way, I know there's some listeners who are saying I'm crazy because you can't afford it. But if we're looking for customer service, in terms of what we try to do in our own practice. The only way that's going to happen is if there's some bit of exchange, and that exchange has to do with service, and it also has to do with dollar value of service. And if you're buying from me directly, you can decide whether you want to buy from me directly, and if I'm lousy, you can go to the other guy and buy from that person directly. And all of us now are competing for customer service, not competing for how much time can we spend with that patient, because we're only going to get $45 for this visit.
Yeah. So what we really are faced with, and then I saw an article in Florida today where somebody was talking about, or I heard somebody say, why don't we just have insurance like they do in other countries where it's very inexpensive? But what they didn't say then was that in some of those inexpensive countries, they're taking 50% of your salary for income taxes.
Yeah, you don't hear the other part of it.
You don't hear the other part of the story.
And that's we're headed towards that system anyway. I think that's where we're going. I think we're headed towards the single-payer system. I think this is just, all right, these are the hiccups that we're suffering through in order to finally go to a single-payer system. And a single-payer system is essentially going to be like every other country that does that. And then people will be involved in the single-payer system, meaning one insurance company is paying everything, one insurance company is controlling it, or the government's controlling it. And then the same thing will happen here that's happened in those countries. A certain number of doctors will fall off of that system, and just like they're becoming concierge physicians here now, they'll become concierge physicians saying, listen, all right, you got that, but if you really want me, you'll pay me, and I'll be able to provide you with the care that you're desiring. And some people won't want that, and some people will.
Yeah, but as users of the system, we can do that. Most people can afford to do something like that, but when you get into the thing like I had when I had my aorta dissection, the bill for that was close to $300,000.
Right.
You know, when you're getting into something like that, there's nobody. Trump can afford it, but I couldn't afford that.
Yeah, actually, we weren't going to talk about this, but what the heck, we're talking about. We never talk about what we're supposed to talk about.
We're going to get back to it in a minute.
Yeah,
anyway.
sure, yeah. Bye. All right, so I got a good audience here. Thank you, Terry. So let's think about this. Do you have $300,000 to pay for an aortic dissection? No. Do I have it? No. All right, so neither of us have it. So now, if it really costs $300,000, somebody's calling me. Where's my phone? All right, so somebody has $300,000. Do you think it really costs $300,000 to do all that?
No.
It costs $300,000 for layers of administrative care. It takes $300,000 in order to be able to protect the doctor. Malpractice insurance. It takes $300,000 to be able to protect the hospital. It takes $300,000 in order to be able to take those people who can't afford it, bring them into that system. So essentially, that $300,000 is not just for your care. The $300,000 is for all sorts of things that if you knew what they were. You know, you've seen the thing, $10 for an aspirin on a person's bill. It's a way of justifying that expense to bring it up that high. If you were paying cash for something, I guarantee you, let's say for an aortic aneurysm, if you were paying cash, then there would be demands upon the system to come up with a cheaper way of providing that service. And then, yes, there would be customer service, but then also healthcare expenses would go down.
And who's responsible then, Lee, for putting all these? And I know the doctors. I've talked to some of them. I know that their time spent in answering questions, filling forms out, and it's costing them because they have to stay overtime in order to do that kind of thing, and they have to have our staff in order to take care of the paperwork. It's gotten so complicated that I don't know how we're going to be able to solve that problem.
We're not. We're never going to go back to where we're talking about. I think people will electively go back to will electively come back in that direction, but It's going to happen a long time, and it's going to be elective on the patient's part.
Okay, folks, we're going to wind down and take the. But I gave you my word. We're going to come back and we're going to talk about a couple of things. We'll get away from what we get off the subject, but there's a couple of things I do want to talk about. I want Dr. Sheldon's opinion on them. So stay with us. I think you'll enjoy the second part of the show, too. Bye-bye.
Lillian McDermott, weekdays at noon on AM 1510, FM 99.9, 94.7, and 100.7.
This is Joe Steckler, folks. We're back live for the second half of our show of Helping Seniors for this Thursday edition. Our phone number for Kay at the office is 473-7770. Please call if you have a question or a comment on the show, or if you want information, call Kay and ask. I do want to mention some of the sponsors. One of several that have been with us a long time and have really been helping us are the Eye Institute. And the Eye Institute is getting ready to open their fourth office up in Titusville, so it shows you that they are expanding. Bill Johnson, elder law attorney. Bill was moved into larger offices. That doesn't mean he's charging clients more money, but it means that he needed to get out of where he was because he needed more space for the records. That's what his girls told me. That's what we're talking about, Lee. The staff tells a good boss when they need something better, right?
That's true.
He's got a good staff. His staff has been with him a long time. Seniors Helping Seniors. It's just an organization that all the people employed there are over 65 years of age, except for the owner. And she's younger. But the rest of the people who take care of seniors are all seniors, which makes them unique and a little bit different. Barbara McIntyre, home equity specialist, Canadian Meds of Melbourne. And with the cost of medicine coming down and being higher, Joe Pons, who is one of the owners of the Canadian Meds of Melbourne, has demonstrated to me honest, accurate proof that he can truly save you money on your prescription medications. There is one procedure that the doctors use, and it costs $1,100 for the injector thing that you get from the doctor, and then they have to charge to put the stuff in and all that. But the same type injection apparatus that sells for $1,100 here in the United States, they buy it through Canada for $179.
Wow, that's good.
So you can buy it for $179, and you've already saved yourself darn near $900.
Now, is that covered by Medicare as well, or is that before Medicare? Or once you're covered by Medicare, you got to get it here?
Well, these are things that people would have to buy, would pay for.
Okay.
Yeah, they have to pay for. But that's just an example of the type of things that if you go to our website, helpingseniors.org, and you look at all these people that are listed there, you'll start seeing services like roofing services. One of the biggest things, Lee, that seniors have a need for is roofing service. They don't understand if they're in their 80s or 90s how they're going to pay for it if they're living on a fixed income. Well, Barbara McIntyre, who is a home equity loan specialist, has helped numerous people right here in Brevard County get their roof fixed, and they haven't lost any income. It just means that they may have $7,000, $8,000, or $9,000 left to leave to a child. But the most important thing I've always said is it's important for the parents to stay dry and not live a wet life in order for their kids to stay dry.
No kidding.
So that's just the way I feel about it.
Yeah.
I think you feel the same way.
I do.
Good.
Good.
All right, let's talk about when you go to a doctor's office, you're not happy with your treatment, or you don't feel any different, and you just hurt like hell.
Yeah.
When should you start asking more questions?
Well, I think, first of all, that's the particular point where you should be asking more questions, okay? And you have to find out from the doctor what other alternatives are there, or what else do you think is going on. I think that sometimes we're too quick to go to the second opinion. I'm not saying we shouldn't get a second opinion, but we haven't gotten everything out of the first opinion yet. And until we get everything out of the first opinion, it still may not be enough. But let's get as much as we can out of the first opinion first, and maybe there will be some answers with that doctor, because don't forget, that doctor has some experience with you and already knows what has not worked, and there may be another alternative there with that doctor. Short of that, or if you've gone a period of time where you've been trying 1, 2, or 3 different things and there's just no change at all, you'll know it based on your comfort level, then get a second opinion. And I would recommend that if you're in an area, both of medicine or in dentistry, where it involves a particular subject, there are specialists in every subject of dentistry, just like there's specialists in every subject of medicine. Go for the specialist.
You know, you did what I did. Wasn't careful when I asked the question. And so many people, I think, don't understand this. I ask you about when should I ask more questions, and you got to the second opinion.
Yeah.
Think about this for a minute, Lee. When a person goes to his doctor or her doctor, and not asking so much about a second opinion, but start asking more questions about. Smart people, I think, are doing a little more research on the internet and finding other things. How is it delicate or not delicate to ask your doctor, well, should we be doing this or should we be doing something else? And we're staying with the same doctor. We're not asking for a second opinion yet, because that's another whole area ballpark. Getting from the questions to the second opinion. Does that make sense?
Yeah, it does. Yeah, and so when we should be asking more questions as soon as we don't have enough answers. I'll give you an example. It just occurred this morning. I have a patient who's been a patient of mine for 17, 18 years and has a particular problem in the mouth, and obviously I've been treating him for the past 17 or 18 years. But there's something new that's cropping up and a different thing that he needs and that type of thing, and I'm checking him at his hygiene visit. And we're starting to go through, actually it's not even a hygiene visit, it's another visit. And I'm starting to go through it, and I'm saying, wait a minute, there's an awful lot of variables here. I need to think about this. So what we did in this particular case, and I'm not saying we do it in every case, we don't, and this is more unusual, but you're going to find doctors who are going to do this. I said, in our office we have 3 doctors, as you know.
Right.
And every Thursday morning for us from 7 to 7:45 is case conference day. That means where we take the complex cases and we go over them and we sort out our opinions in order to be able to come up with a treatment plan. So in this particular case, I told the patient, we have our case conference on Thursday morning. Why don't you come in and hear us think about it hear us talk about it as we're thinking about it, so that we can come up with some answers. It was a great experience for all 4 of us, the patient and the 3 doctors, because we were able to bounce ideas off of each other. Everybody was looking at the CAT scan and all the other softwares and the x-rays and everything else at the same time. And so we started to develop treatment plans. We'd all thought about it in advance anyway. He could participate, and we say we can take this option, we can take this option, or they take this option. One will involve an orthodontist, one will involve extractions and implants. And we need a little bit more information from different sources in order to be able to get that. How do you feel about that? Would you like to go for another opinion? In this case, we need to send out to an orthodontist in order to be able to get some real answers to whether this person who's well into his 50s should and can move teeth at his age, whether that's a better option than extracting the teeth and putting in dental implants. How do you think he left that visit where all of us were together, all of us looking at the x-rays at the same time? If you can get a doctor, and there are many out there who are that dedicated, they're going to spend the time with you. And doctors, doctors will start at 6 in the morning and get done at 10 at night. They'll do that. And they'll do that because they're really, really interested in healing patients. If you have that kind of a doctor, that's the one you want to stay with. And that doctor is going to be smart enough to say, I think we need a second opinion, rather than you're saying, I'm going to get a second opinion.
Okay. I think of my own case. For years, I have been plagued with gout. They haven't really figured out why, but it's an intermittent thing. I don't have it very often, but when it happens, it's very painful. Yeah. And if anybody's had the gout, knows how painful it is. Well, 2 days ago, for about a month ago, I started hurting my right knee, and didn't think too much about it. I talked to the doctor, and we did something, but it didn't work. And I went back, and I said, this really bothered me. He said, why don't we try a shot? He said, let's just see if this shot, I'll put it on this place here, and we'll see if this really helps. And it did. It really helped. Well, about 3 days ago, my knee started getting very tender again, but now my ankle was tender, and I noticed my right foot was swelling. And my right foot was hot, but my knee was not hot. And I was all I could do to walk. I couldn't hardly put my foot over the side of the bed. It hurt that bad. And then to walk on it was the agony. So I went over, and the doctor said, You can't take colchicine, and this is a primary thing I like to take because it destroys my blood platelets. And see, this is what other people, which you have to be careful about, listeners, is that you yourself have to keep track a lot of times of what different doctors have told you about what's good for you and what's not good for you, because all doctors, they're not mind readers. They can hear what you tell them, or they can see what an x-ray shows, or they can see what a CAT scan shows, right?
Yeah, right. But your medical history is something that you should know better than anybody else.
Right. So this doctor says, I can't use this and I can't use that. So what he did was I asked him, about the prednisone 6-pack. Well, he gave me a prednisone 5-pack of his own making, and I took a very large dose of prednisone last night. And Lee, I told my wife that I felt better from my inflammation, my fibromyalgia and everything else. Last night, I felt better than I had in years. The pain throughout my body from my feet to my neck was almost all gone.
Prednisone's going to do that for you.
But I can't stay on it.
You can't stay on it.
I can't stay on it.
Yeah.
So now we have to figure out some other way to keep the inflammation down. And that's the other part of that question, the second opinion, and gets back to something else we had near the end of our show today. We'll go ahead and talk about it now. Can a body always be fixed?
Well, maybe it can, maybe it can't. But understand that there are specialty centers all over the country that will handle a certain problem. For example, gout. There may be a gout specialist. He may be in another state or another part of this state. Florida's big enough that it's probably in this state, where you can ask your physician, well, who is the best person in the state with regard to gout? Chances are he knows. Or he knows who to call to find out who the best gout person is. Who's doing the research? Maybe who's doing university research on gout? And can we see him? Or can we consult with him? Or can we send our records to him and pay him, if you pay that other person a few bucks to look at your records and see whether that person might be able to help you?
Now, that's good advice.
Yeah.
I didn't think of that. Didn't think of that.
Aren't you glad you're doing this show?
I hope my wife is writing this down. I hope she's writing it down. I know she's listening, but if she's writing it down, or else I guess I can depend on her memory too. That's pretty hard sometimes, but I try.
But I did that. There are some. Okay, there are some problems that we've encountered, and you and I did a TV show about it, and we did a radio show about it too.
Right.
Where you look at the local opinion, and the local opinion will only go so far, and you're assuming that the local opinion is not the only opinion, or is the only opinion, and then you just do a little bit of research, or in this case, we pump the doctor. Is there somebody else? Is somebody else? Is there somebody else? And finally, the doctor says, "Yeah, there is somebody else. Go to the Mayo Clinic," and they do that a different way. Remember how we talked about that?
Right.
So,
I remember.
Yeah, it does go beyond. We all have our areas where we have our strong points in every aspect. And if we're smart, the smart doctor knows where his strong points end and where his weak points begin, and then makes the referral.
Well, there's one area I want to talk about. I don't want to close on it, so I'm just going to go ahead and ask a question now. And that was the last question I wanted to ask you today. And it's not a question to close the show on. It's one that should be talked about a little bit before. And because Broward County has 250,000 people that are classified as senior citizens, so we are getting older. I'm older, and I recognize this. And, most people want to live. And my last question was, can a body always be fixed? If not, how do we know? And that's a question. You had some pretty good comments on that before we started the show, and you talked about it. But I'd like for you to talk about that to our listeners a little bit, because I think it's a very good commentary coming from an orthodontist. But I think we should remind our listeners, Lee, that dentists also receive a lot of the same training that medical doctors do.
Yep.
And while they might be called a dentist, they're still a doctor. And we forget that a lot of times. Dentists have a very good knowledge, and I'm going to reaffirm that by looking at your book, The Ultimate Mouth Manual.
New edition will be out next month.
That'd be the third edition?
Yes, third edition, yes.
Okay, but see, Lee, Terry, people, I mentioned my wife's name, mentioned Lee's name. I get excited about his third book because the first two books are darn good.
Thank you.
And I always go back to when I opened Lee's book up, when he gave me a copy of the first Ultimate Mouth Manual. the drawings in there were so darn simple that I couldn't even understand them. And I realized then that he'd drawn them himself by hand. So they had to be simple for him to draw them.
And I put in a new set of drawings just for you.
You did?
Yes.
Okay, well, I'll recognize me. But folks, this is something about medicine that more of us
I
need
worked
to
hard on
understand.
those simple drawings. Took me 5 hours to do. I want you to know.
Okay. But Lee, if people would make up their mind that they could do a little more probing, a little more internet research, a little more asking questions of friends that people may have had the same problem, there are a lot of solutions that are ways to do something better than we've picked out to do them.
Yeah, there are, but I want to get back to your more interesting question.
Let's go back to that one.
Okay, your more interesting question is, can a body always be fixed?
Go ahead. I want you to talk about that.
And it can't. It can't. I think, and this is philosophical, but I think we all need to start visiting some of those decisions ourselves, because what you're hearing on the news is actually true. If there becomes a single-payer health care system, then somebody else is going to be making decisions for you as to whether the body can be fixed or not. We have, and I understand, people don't want to die. They don't. At the same time, sometimes people will say or ask the doctor to take extraordinary means that the doctor knows won't work, but it's covered by insurance, in order to be able to do some treatment that isn't going to work. And what's more important is when they do that treatment that isn't going to work, it diminishes the quality of life for that person. That person's going to die anyway, and now we put the person through more pain and suffering in order to hang on to some kind of a hope that that person is going to last a little bit longer in that particular condition. I think if both the patient and the doctor were doing their research and they were really looking at it well, and I'm talking about particularly the patient, not as much the doctor, and the patient does say, all right, if it's extraordinary means and I'm not going to be doing very well, let me at least enjoy the last few months of my life doing it that way, doing nothing rather than doing extraordinary treatment. That's going to help. It's going to help all of us. It's going to help our healthcare system. I think sometimes we just have to understand we should be looking for avenues for help. We always should. But when it gets to the point where it's extraordinary means, then extraordinary means usually doesn't work.
A lot of times, Lee, when I was a younger man, I got to thinking about, I heard people say, I don't want to be kept alive if that's what it's going to entail. And I couldn't really understand them admitting to giving, or I kind of thought that was giving in to the inevitable, and that they were not willing to fight for their life. But as I've gotten older and I've experienced some of the pains and some of the things I've gone through, and some of them have been pretty painful. And I can remember my grandmother, who passed away at 88, and she just was in agony, and she had arthritis. And then I knew another younger woman that my wife and I both knew. I was a godfather from one of the parents' daughters, and she had rheumatoid arthritis. And the only time she was free from the rheumatoid arthritis pain was when she was pregnant. That's the only time. She had 3 girls. That's the only time, from the time she was about 23 or 24, that she didn't have extreme pain.
Yeah.
And she lived like that. And I watched her have her thumbs fused, her fingers fused, and she did all kinds of things. But she never lost her sense of humor.
And that's good. I mean, we have somebody who has life. You know, the life is not just the body. You know, I don't want to go too far out into religion, but certainly there's the spirit that carries the body. And so here's a person who's had a sense of humor her entire life, racked with some pretty bad, painful problems that have required multiple areas of surgery and certainly pain her entire life. That's not what we're talking about. What I'm talking about is this. And, you know, we talked about it at the break, and it was new information for you, but it might be new information for some of the listeners, too, is that we spend more money per year on our last year of life on health care.
I was hoping you mentioned that, because I thought that was really an amazing statistic.
Than any other year. By far we do that. And so, you know, we're talking about end-of-life decisions, and end-of-life decisions may not be best, in the hands of medicine. It may be in the hands of something else, but hands of medicine may not be where we want to go if we really want to enjoy that last year of our life.
Yeah, and it's the same thing when I've done so many shows on hospice care and what hospice care really is, and when people don't understand the difference between hospice care and aggressive care, and there's a realization that I frankly don't. I think some hospices are better than other hospices. I think hospice is the demeanor of the hospice team is evidenced by the quality of the people on the team.
Yep.
I think it makes an awful lot of difference, and I think Brevard County is really privileged to have some really good hospice organizations. Yeah, we have 4 here.
Yeah, and I've had some good experience with hospice myself.
And that's really good. So here we were today. We're talking about doctor expectations. What should your expectations be of a doctor? We talked about that. What should you have of the staff? We didn't talk about calling for an appointment. What would you look for? Yeah, that's a good question. When you call a doctor's office for an appointment, what should a person expect?
I want that person to have 100% attention on me, the caller, and not be checking out patients, filling out insurance forms, looking and talking to another staff member, and be distracted. I want that person directed
and putting you on hold and time after time and all that.
Oh, putting on hold is ridiculous. Yes.
It just drives me nuts. Yeah. And then the other thing, one that we didn't talk about is how should you react to a bad day at the doctor's office?
If it's one bad day, just ask yourself a question. Have you had one bad day? And give the doctor another chance. Or in this case, please give me another chance.
Okay. Well, that's a good question because everybody has a bad day. And I know that we all go in and we expect the staff. I joke a lot with the staff or my primary care physician. I know them all. One of them was the chief petty officer in the Navy, and she knows me, and she jars with me, and I do the same thing with her. But when I call and say I hurt, they said, "Can you come in at 10 or 1:45 today, Joe?"
Yeah, and that's good.
And I'm so very fortunate that I have a primary care physician that knows me well enough to know that I won't call unless I really hurt or if I think there's something he might be able to do for me.
Yeah. And doctors know what their schedule is going to be like. They know that there's going to be a certain number of emergency appointments that they're going to need per week, and they actually block out the time for it. We do. We all do.
You're the first person I've ever heard say that.
Oh, okay.
I never heard that. That's good, something for somebody to know. So another good thing, we're almost out of time, but maybe we all need to be a little more persistent in explaining to our doctors what we think about our own body.
Well, I think persistence is good. I think persistence in getting the right answer is even more important. I think the worst thing we can do is shrug our shoulders and say, the doctor knows more than I do. We need to know as much as the doctor does.
We do a lot.
About ourselves.
Okay. Thank you, Lee. Thank you for doing the show. And I hope you've enjoyed our show today, folks. We'll be back with you next week. In the meantime, go to our website and check out our new 1951 Ford Victoria raffle car, the same one like that Robert Mitchum drove in Thunder Road back in 1951. We'll see you next week. Bye-bye.